reason I brought you here today is to make sure you understand where your overall health goal is going to be. Okay? And everyone's different. Everyone is completely different. Some people just want to get out of pain. Some people want to improve so they actually become more athletic. Some people want to stay younger. Wherever you are. So we want to make sure you understand with our chiropractic care is we're the one step you need to progress to that point. We're your momentum pusher. We want to make sure you understand that to where your body can actually heal and get there. Okay? The first part I like to kind of read, the purpose, is the chiropractic philosophy and shift the patient's perception of chiropractic care. One thing people still don't know as chiropractors, we don't prescribe medication, we don't do surgery. People still walk in like, hey, can I get some ibuprofen, some Aleve, some 800? I go, no, we don't do that. We never have since 1895. Over 100 years, right? But people don't know what we do. So we have to educate them by these videos so you see exactly what we do. How we can help them as a specialty. If you have a foot problem, doesn't get better, who do you see? Your podiatrist, your foot doctor, right? Same thing with a hand specialist for it too. Chiropractic focus on the spine, because the spine is your entrance into your nervous system, which controls the whole body. We'll talk about toward the end there. Okay. Second part too is we extend treatment beyond neck and back pain to help patients achieve complete wellness of the mind and body by the choice of three things: exercise, maintain a good nervous system, and also good nutrition. If I just adjust you and say, yeah, here's a bunch of donuts and sugar all day long, phenomenal, it doesn't work that way. Perfect time, we just started. Right there. I'll get some forms with your breath. Do you have any forms?
Yeah.
Good, perfect. Good. Good. You just started, Ann, right?
Yes.
Yes, me.
Oh.
We have a bunch of papers.
Are you sure?
We use paper all day long.
Okay.
We'll have two more in a second. Okay, so we just started. So part of this paper says, we talked about how as a chiropractor, we don't prescribe medication, we don't do surgery. And our purpose here is to make sure that your mind and body understands what it's going to take you to get healthy. I see you maybe 15 minutes in here, right? I don't spend all day with you. I don't have time for that. Okay, you have other things to do. Take care of your family and life. But what can we do outside the office once we adjust you to make sure your body can get there and stay there? Give you the tools, exercise, think right, eat well enough so your body stays healthy. This is Taylor, our front staff. She likes the camera, that's why I always put her out there.
Perfect.
All right. Thank you, Taylor. Bye. Thanks. So first part to talk about here, the middle part, is chiropractic treats the spine to influence the function of the nervous system. Okay? So our job is not just to move the bones, but make sure the inside of your nervous connection works properly. How it works is we want to understand embryology, how the body forms, to understand how the body actually develops so your body can work properly and normally have a good wiring system so your body can work. So here is going to be, after the spermia come together, I'm not sure if Sarah's had embryology class or whatever it is too, everything starts developing, right? Everything goes from a bunch of cells and starts migrating and kind of just developing where they move around. So that first thing is called a mesoderm. Okay? That's your first group of cells starting to communicate to break down and develop into bones or muscles or soft tissues, whatever it might be, after about 7 days of fertilization. Okay? The first thing to form from there, the first breakdown, is going to be your primitive node and primitive streak. What do you think that is in the adult form versus the fetus or the embryo? What do you think? Not the head and spine, because the head's the outside, right? The inside, the brain, okay, and the spinal cord. The first thing is to form. Why is that? Because that has to go from there, has to work around there or inside there. After that's going to be two things. After that's going to be your wiring system that goes from the spinothalamic tract on your right side down through your spinal cord to your upper body, and then down here the same side. Okay? So your wiring system works to go from the brain down through the spinal cord to the whole parts of the body, and not just out to the body, but also through every organ down the line, every tissue, everything that works, that regulates through the spinal cord itself. Okay. Again, I'm not an artist, as you can probably tell. Not even close. So I just draw these as your appendages. Okay, very simple, very easy. Some people think turtle. Very difficult. That's up to you. I will not judge. Okay. After we have that, And we talked about the nerves go to every organ of the body, every tissue. We also want to form the organs too, correct? The heart in the middle here. Maybe a liver, kidney, middle. And then maybe a couple kidneys over here. Any questions so far? It's like a mosaic or something. I'm not going here yet. Okay. So once we have that, then we'll protect everything, right? We want to make sure when it comes out, when the fetus is born, it's protected and shielded. So the last thing we do is develop the skull and also the spinal column, the bones, to allow it to handle load, pressure, and not break down over time. Tailbone, very bottom. Kind of looks like tailbone, at least one bone's looking normal. Any questions about that? You want the umbrella to form properly, and it happens about 99.9% of people. So once we're born healthy. What happens outside to make our body become injured, traumatic, stressed, so now we feel problems. It doesn't happen overnight. Unless you're in an accident, it doesn't happen overnight. Okay. Next part here, down here after the 6 numbers, talks about what controls the development of the function of the human body. There's a pulse that goes through these nerves. It has to work in a wiring system like a wire, has electrical millivolts, has an electricity through it. That has to work at a certain level for your body to stay normal. Because that nerve isn't important because it doesn't feel any pain. It's what it affects, is what organs it controls, what muscle controls, what joints. That's what's going to cause you to feel symptoms. So if that pulse is off, you're too high or too low, your body become non-functional or abnormally functioning. Let that happen normally, okay? So let's take this down. So we want to do, I'm going to erase, is that okay? You guys got this in your head? Mm-hmm. All right, good. Get it off here as soon as possible. Embarrassing, so. Embarrassing. Here. So once we have a nerve, you can think about more of a column, that small nerve you saw a second ago going across. If you blow that nerve up and magnify it, we're going to have more of a tube. Okay? That tube, if you what's it called? When you look at sine tangent or cotangent, that wavelength, talk about math, that nerve, when it happens normally functioning at a normal millivolts or electricity, should fire within that range. Nice sine wave all the way through. Okay? If it's irritated, being pinched by the disc or other issues, at that point, if you have problems to where it can initially overfunction and then cause go outside that range. So that would, what do you think that would cause when it becomes irritated? A nerve. What do you think? Pain. Pain, exactly. Pain, headaches, dizziness, vertigo, a locking up of the joint or muscle. Okay, neuropathy down the arms, down the hands, even eye pressure too. Also, it can cause issues we'll talk about in a minute, affecting your organs too. Okay, if the organ is stressed by a stressed nerve, will your bladder contract or will it relax? What do you think? If an organ is stressed, how about the heart? If the heart's stressed, will it become more rhythmic, higher, faster beat, or will it relax? Right? Okay, it's going to become more rhythmic.
Yeah.
Okay, more stressed. Your body does the same thing. Nerves that control your arm control your heart. Okay, I'll show that in a second. I'll prove that to you because I see some naysayers out there. Say that, I don't believe that guy. I don't know what he's talking about. Okay, last one, I'll draw it up here so you can see it. The nerve gets shut down or irritated too long. The last part is it actually shuts down, becomes non-functional. What do you think happens there in a muscle? We talked about, Christine, how that causes pain, right? Mm-hmm. Or irritated. What do you think happens here when the nerve shuts down?
Numbness?
Yeah. Don't feel anything?
Or weakness?
Good answer. Numbness. Weakness is the better one. Numbness can be either one. Numbness can be this one as the nerve becomes irritated. That's more sensory. Weakness is here. Things start shutting down. Weak hand, weak leg, weak arm. More muscle control. Okay? On bladder control, you lose bladder function. Okay, things we don't want to think about, but that can happen. Someone comes today's had it for 2 months, and now they're figuring out, hey, okay, maybe see a chiropractor, is where it's coming from his lower back. Because what's going on here with the nerve system Normal, short term, long term. Okay. Any questions so far? Wow, we're at the naysayers. Let's see what we see. This bottom part talks about subluxation. That's a chiropractic term. What it means is that when these nerves do get irritated, it also, the complex, it affects a function of the body, a location and function. So the subluxation in the spine, we'll talk about how things lock up. The location function is that three-part complex called subluxation, where that point decreases that function. What happened back in the 30s, I forget the guy's name, he invented a tool to measure the body's energy by light. It's like pop something. And what he did is, when he measured it, when the body's healthy, the nerves are here, the light was consistent. Body was irritated, say abnormal function where cancer, for example, multiple cells growing too rapidly, it was here. Light bulb would actually be more intense than normal. As things shut down in the body, for example, late stage cancer for 1, 2, or the body loses organ function, the nerves would come here, so light would actually calm down. So subluxation is sub less than, lux light, ation means something else, I don't know what that means. Not an English person. That complex is what we're worried about. Nerve being pinched, the location and symptom afterwards too. Then we'll go over that in the last page you have, exactly what that means. Questions about this diagram? A little bit better, right, to look at? Not as nauseous, causing. Okay.
Not as entertaining.
I like that word. Use that a lot.
That is good.
Use it a lot of people look at me, what are you saying that for? Good. Okay. So here, second page is how your body's affected by a pinched nerve in the spine or body. Here, we'll talk about exercise to start with, 5 factors. This is when we're after we're born, right? We're all mostly born healthy, okay? What we do after we're born sometimes affect us through trauma or injury, or over time, our posture, position, or stress on our body. So first we talk about here, see if you have the same one, because I have different versions. A little different than somebody using yours, Albert. Here is subluxation, locking up the spine causing a location function problem. At C6 affects the neck and stiffness. So here, at C6, can cause problems so where it can go from the neck down, if I turn this on, down the arms or hands. So a problem here can cause numbness, neuropathy, pain and weakness down the arms and hands. This is physiology. It's not chiropractic. It's not a religion. This is just how the body works, physiology. So if that's happening, we look at if someone has, for example, an elbow problem, and go, it's not going away. I have problems. It just feels pretty bad. Numbness in the morning all the time, especially with one hand. Can the problem be here? Take the X-ray to prove that. I always talk about on my videos and my patients X-ray analysis. That's how we know if the nerve is being pinched or not. That's how we know if it's being irritated, weak, or normal. But it's so important for us to have that on site. That's why 2 weeks ago we had re-compliance with the state to make sure it's available and policy use it all the time, every day. Okay, that's the number one way to know if the nerve is being pinched. Second one, here. Okay, so affects the tips of the neck and upper arm. If you go to your other form, your last form that you have that I don't have, and go to actually the last form, right here. Here, this is your nerve chart. Okay. Chart affects the spinal alignments from 1, 2, from Gray's Anatomy. So we talk about in the spine, where the spine is, each location of the spine, location of the body it's affecting, and the symptoms it has. If you go down to C6, 1, 2, 3, 4, 5, 6 from the top, talk about neck muscles, shoulders, and tonsillitis, tonsils, location, stiff neck, pain in the upper arm, tonsillitis will cause symptoms of the body too, and croup. So that stiff neck and pain in the upper arm comes right from the location of the actual spine. So location again, the misalignments, location of the spine, location of the body, and symptom. Any questions about that? It's on paper, it must be true, right? It's on paper. I think, I don't know. But that's what I was told.
Did you get it from the internet?
Probably. That one website, they shut down a long time ago. Okay. Any questions about that? So when we exercise, going back to exercise, affect the body, why can't my shoulder get better? Why is my arm always weak? When I lift weights, my left side is always weaker. I don't have a shoulder problem. I don't have an elbow problem. It's a nerve in the neck, making that muscle stay weak because it can't function normally. When you sleep, you wake up, it's always that left side. The nerve in the neck, again here, runs down the arm, causing the issue to happen. So again, we take the X-rays again to go back full loop to make sure you can actually exercise again. You free up that nerve, make the nerve work better, correct the spine, exercise becomes even on both sides, muscles get stronger and more relaxed. So overall, if that feels better, our goal is, can we get our body back here, strong back here, even left, right, front and back, so our body stays strong here. You don't have to see me. Too busy as it is. All right? Any questions? Second part. It talks about, you can go to T1, 2, affects lower arm or hands. L3, same thing too. The last one is L4. This is a lower back issue. So where if you go in L4 here, causes leg pain, symptoms down the leg. If you go to your form, the nerve chart, again, go down to L4 at the very bottom, take third from the bottom. Same thing, causes sciatica, pain down the leg. Same thing. Okay, this is physiology. It's not just chiropractic, physiology, how the body works. So someone has that, they come in with that. First thing we do, take the x-ray. Don't mess around. Make sure we see what's going on inside the body first. Okay? That's how exercise can be effective. So we want to make sure our body can do that. When you sit for long periods, get up and cause leg pain or back pain, same thing. Get your body strong so you can handle the sitting. We've got to start with your spine first. Find out what's going on in the spine. Make sure your nerves are working properly, not irritated, so our body can get better and stay better. Any questions about that? Is it blowing your mind, sir? Second one is diet. 2. Okay? Diet meaning nutrition. Can you eat well and still not have the health benefits that you should be having if you're eating well? Can what you're going through, can you have an intestinal issue or a spinal issue causing that to happen? Okay? In your spine again, so you're going to see that at T6, 1, 2, 3, 4, 5, 6, so about here, is your gallbladder. Your gallbladder can cause pain in your middle back. It's called the somatic reflex, to where that organ causes mid-back pain at T6. Someone has gallbladder issues, what's the first thing your medical doctor wants to do?
Take it out.
Take it out. Do surgery.
Yeah.
Okay? I had 2 patients about 4 years ago, within a 3-month period being told take it out. Actually, 3 patients. 2 got it taken out. 1 did not. We helped fix their mid-back. They still have their gallbladder today. Miracle, right? No, it's science. It's how the body works. You can actually have his back. He was hunched over. Had a lot of GERD issues too. Hard to eat without having that reflex and having chest pain. So by giving him some supplements and very simple things, apple cider vinegar. You guys have that at home?
Yeah. Some right now.
All right, good. I live on that stuff, right? And I'm like, I feel a little bit off. Good, apple cider vinegar, full shots. Okay? But that's the key is, how do we look at our body and go, what can we do on our own first before getting medication, before getting something taken out of our body? Because I had a patient come in, Eric, it was Eric? Eric. And he told me, that's what it was, told me on Monday, hey, I can't make it on Wednesday. Why not? What's wrong with you? I'm having surgery. What are you talking about surgery? My gallbladder's coming out. I'm like, why? Same thing. Before you do that, take some apple cider vinegar, start there, do this, within a week it was gone. Why don't medical doctors do those tests? Or simple things. It comes down to that's their realm, that's what they do, that's their paradigm. We want to look at the overall body. We talked about philosophy of chiropractic, keep your body healthy naturally without medications and surgeries, if possible. Some people can't. But why are we spending 9% of our time doing just surgeries and medications versus switching it around and going, okay, look, what can we do easy on our body and go there? I did a talk to UFC gym in Ontario back in late December. Darrell was awesome. He's from the South, right? Real thick accent. And he said his mom, every time he was sick or had a headache or had a cramp or just didn't feel well, drink some more water. And that cured most of the issues. Simple things we can start with first, and then if we need to, go to medications and prescription medications. Does that make more sense? Yeah. Then all of us, we want to do this. What's in the medicine cabinet? It's Excedrin, Advil, Tylenol, whatever it is. It's our first line of defense, because that's where we grew up. Right? My mom was a nurse. When we get away from that, realize that's like getting your body healthy, getting your body probably not sick, but not the healthy. We can do these things and see an overall health benefit. Any questions about diet? How it can cause a somatic reflex to your spine, causing pain that way? Or you've all heard of kidney problems causing back pain? Same thing. Okay? It's all related. You guys know this, right? Now you know how to correlate it with the spine. Next one is sleep. Who has gotten a great night's sleep the last, say, 3-4 weeks or so? It felt great every day. No, not me. No, not me. I'm a chiropractor. I don't get enough sleep. Okay? This is an important one because this one affects your whole body. Sleepy talk, it says here about C1, very top vertebrae. And then, what does that say? C1, blood's by the head, pituitary gland, blood, scalp, bones, the face, brain, inner middle ear. You know what the sympathetic system is? Sympathetic nervous system? Sympathetic? Here, I'll show you this. This is important, people. Okay. Again, apologize for my spelling, my artwork, and everything else in my life. I'm on therapy tomorrow, so I'll figure out therapy once I work out. Okay. Sympathetic is your stress response. Okay. This allows your body to get away from the tiger when you're chased by a tiger. Or here maybe a bog pepper or a coyote. Where's where you live. Okay. So you want to make sure short-term our body knows what to do. Get the heck out of there. Cause all the blood to go to your limbs. At that point, run away. Or if you have a mouse in the bathroom, don't even go near the mouse. Just let someone else deal with it, like Albert.
Give me a broom.
We had a mouse in the bathroom earlier. First time ever in 15
Are you
years.
serious?
Yeah.
Oh, you'd be
I was like, there's no way. I'm talking about. I'm not.
No,
Without
you
this
don't
guy,
be
we would
up
have
there
not had this class outside in the streets.
then.
I said, going, I'm out of here. I'm gone. Okay. This is how your body responds to a quick stress. Watch a scary movie, my heart rate goes up, I probably scream. This happens to me once in a while. But when it happens when your body stays under stress the whole time, then how does your body respond to that? You have problems where then it affects your nervous system, so overall things stay stressed at a stress state, becomes your better normal. That becomes your not better, but your new normal. Then, here, at this point, that C1 area affects the whole body. We talked about earlier how the bladder is affected. Even your intestines where you have constipation, diarrhea. Arrhythmia in the heart. I had a patient 4 years ago now in her mid-50s, and she came in because she just was going to quit her job having chest pain. I go, chest pain? I'm a chiropractor. EKG is normal, heart's normal. Stress because of her work driving from Rancho to City of Commerce every day. Hour drive at least. Sitting at a desk all day like this, and then driving home for an hour every day. For probably 5-6 years. Stressful. So her body had gone from here to here to here to here. Your mid-back freezes up, so your overall body stays compressed, can't breathe normal. So what does your body do? Go under stress and make that heart become more stressed, causing arrhythmia, causing a faster heartbeat. So what does that do? Makes your overall body stressed, so when you start losing sleep, becoming anxious. Your body chemistry changes also. If you have a stuck joint in your body, this is beyond this talk. That stuck joint, if you have enough of them in your spine, makes your body produce more stress hormones, cortisol, catecholamines. That chemical reaction to your brain goes to your adrenals. Adrenals will produce hormones that affect that, causing your body overall to stay stressed. The feedback loop. The more you move, if your body's stuck like this, are your joints being stuck to where they can't move? Yes. So our job is when you see someone and they're having pain, how's your posture? Where's your posture? Has that changed over time? Become more like this where your joints no longer move to cause that stress response? Here, keeping that system going. This is all your blue nerves. Yeah, all your blue nerves to everywhere in the body. The green nerves is the opposite. That's your parasympathetic. So parasym. Okay? That is your relaxation. That's production of serotonin and endorphins when your body moves better. When you ever work out, when you work out, you go, man, I feel really good afterwards. I feel my stress has calmed down. Because of these are causing those endorphins to kick in. And all serotonin in your body produced. So everything here again, same thing in the organs, right? Relax in the body. The patient talked about a minute ago about the heart arrhythmia, about a month and a half or so, where her body started going from here to here to here. Neck pain started going away, mid-back pain going away too. Here we started having her walk when she came home after work. It was summer, so it was longer days, right? 10 minutes, then 15. And then when she went to work, she said, maybe at lunch I'll walk for 10 minutes too. 15, 20, 30. So her body went from here to here to here, and walking back here, so her body felt better and stronger. By us loosening the joints up, causing this to calm down, this to actually improve more, that balance occurred in her body. That was the key. So the arrhythmia went away. She didn't have to quit her job. Her body went to a better homeostatic state. If you're there, then can you handle the drive? Then sitting in an office, then driving home. And then still coming home like, man, that workout made me feel good. I'm going to work out again and again and again. I work out because it releases stress in my body, keep my body tolerate more stress and not be able to broken down because of that stress in my body becomes more symptomatic. That was the key with her. So that sleep is the result of the body staying relaxed. When you get deep delta sleep, not alpha sleep, your body can actually recharge. What I tell my patients, ask my patients is, if they're under a lot of stress, especially chronic stress in the neck and shoulders, where the lot of nerves come from, I ask them, how do you sleep? Because I want to see, do they get the deep delta sleep where they recharge, or they're batty when they wake up and they're only half charged for Tuesday, then half charged on Wednesday, and down the line all the way by the time Friday hits, their day is done. Their body doesn't get that relaxation technique. But that's getting the body loosened up as a chiropractor, then they can exercise, and they can do things to get their body under, to get out of that stress state. That's the plan what we do. Okay? Even when you're not moving, if your body has a normal position, normal posture, ability to move normally, that alone keeps those joints loose, not compressed where your body's staying this way. Okay? Next one, you're getting harder, so make sure you pay attention. The next one. What's that? Yeah, PMA, right? Is that what you have, PMA?
Yeah.
What could that be? Boom. What? Amy, you're good at this. You must have taken some type of psychological awareness class or something.
Positive mental attitude.
Wow, okay.
Good.
Exactly, positive mental attitude. It's not PMS, PMA. Okay, so make sure you see that. Okay, that's the key. Without that, would you want to exercise? Have better nutrition? But realize if you're under stress, what happens to your attitude? Grouchy? Right? So we want, when you're under stress, what kind of food do you eat?
Donuts.
Where's the donut shop? Exactly. Okay, where's the sugar? Where's the simple carbohydrates? When you're more relaxed, your body goes, it wants more protein, more complex carbs to feed those type of hormones, endorphin, serotonin. So realize when you listen to your body, if you're under stress, you go, okay, I'm under stress, my body's going here, where I'm producing more catecholamines, I have to feed it this to get out of that state. I have to move to get out of that state. It's not just one thing, it's everything. When you get there, your body gets to a better state, it can stay there a lot easier. When you're in chronic pain, that's when you get here, hard to get out of there. That's why this form gives you an idea of where to look for when you do have problems. Okay. Next one, since Amy ruined the last one.
I don't know
It's
this
here.
one. I don't know this one, so you got it.
Well, good. Thank gosh. I don't know everything, even though you tell Eric that every day. Good. What's H&S stand for? What do you think? Sarah? Anything?
I'm looking it up.
What does it say?
She's the smart one.
What's it say?
I don't know.
See, they don't even, Google doesn't even know.
Not
It's
an
amazing.
Urban Dictionary.
Google does not know. It's amazing. This is a confusing one. Talked about here on your form. Let me borrow yours one time. It talks about here on the actual effects from the very top. It says, from Gray's Anatomy, which is the Bible for anyone who studies human physiology, the nervous system controls and coordinates all organs and structures of the human body. Okay? So, that works if you have a healthy nervous system. That means all of this up here can work well. That means all of this stays relaxed, so overall body can function at a normal level and tolerate more stress and stay that way. Any questions about that? Amazing, huh? Wow. Just blow your mind type of amazing. Okay. That's the key though. Whatever you have to do, simple things, and I did my podcast part of this too, simple things to get your body healthy and stay there, focus on that. So when you do have something, I had someone come in today, and he's had sciatica for probably 9 months. Accidents brought him in that way too. Sciatica's gone, and that's having some leg pain down here for about 2 days. But now it's going away faster because his body is getting better. When your body's healthier, you're going to have problems where you hurt yourself exercising. You have problems with sleep. You're going to have problems even with attitude, maybe even diet too. But you recover a lot faster when you're healthier. You have an idea what it takes to get there. You get there real quick. Any questions at all? All right. Here's the big picture. This is what we want to focus on. When you have a good attitude and feeding that, it becomes easier. And our job is to make sure your nerves don't make your body stay under stress. Stay here, and you want that every day. People get addicted to exercise because you know why? Because it makes them feel good. That's the only reason we do it. up at 5 o'clock every morning. And my brain says, go work out. I'm like, okay, whatever. But you go because I come home and go, that's why I do. That's why you do things that sometimes you don't want to do because it feels uncomfortable, because you're stuck here and you want to get out of that state. This is your normal. If this is your normal, you're not going to want to move unless you have a bad motivation. Hey, I don't want diabetes. I don't want high cholesterol. I don't want hypertension. I don't want rigor mortis. Rigor mortis is horrible. So avoid that by moving your body more. We move the joints to make sure your body can do that. Any questions? Yet? All right. That's all I got. That's it. Besides the mouse, hopefully it stays back there.
It's gone.
It's gone now.
It's
Good.
outside.
Somewhere on the front maybe. I don't know.
Looking for holes.
That's it though. When you understand that, realize keep your body healthy so everything here stays well when you feel well. And then supplements if you need supplements. Get your body to where it feels good state and maintain that. And I'm not one you spend $100 every month and do this, that, and this. Simple things you can do for yourself, your favorite foods. What I have my people do, this is at my talk in December, is log your food for a week. What you eat every day, every meal, every snack. What can you do during that 7-day period? Like, I like that, but that's not good for me. I'm going to cut that out and replace it over here. Or how much do I exercise? That gives you points, if you want to call it, I think it's Weight Watchers. You can actually eat a little bit more. But what do you want? What's your health goals for this year? How do you want to get there and stay there? What we talked about too, Albert and Miguel too, is guys hate to stretch. Guys we loathe stretching, okay? But that's something we need. Because we're not 20 years old anymore. I had some kid earlier, he plays football at Upland High. He's just a little Gumby guy, right? But we have to stretch, especially hamstrings and legs. Because that gets our back stronger. So we stay here instead of here. So add things to your routine, whatever your week, get that stronger. And that gives your overall foundation of health better and better and better. 3 things that is your health: physical exercise, stretching, and endurance, right? We do strength, flexibility, and endurance. Work on those. Whatever you want to do a little bit more when your body's ready. At that point, push a little bit more. As we talk to my patients is really, how do you get to a certain point where you can maintain that on your own so I don't have to see you? All right, I'd rather be playing golf or something. I don't want to do it. I don't know, tomorrow. I don't know. Any questions? My soapbox for the day. Thank you for coming. You've entertained.